Hello, I'm Dr. James. Have you ever noticed how a woman's body subtly changes after the age of 60? These are changes that almost no one talks about, yet they can completely transform your health, well-being, and even your self-esteem. Skin thins, hair changes, and sleep isn't quite the same. But there's one part of the body that suffers in silence. This is precisely the area many women avoid looking at, touching, or even mentioning: the intimate zone. After 60, the vagina and the entire pelvic region undergo profound transformations. Natural lubrication decreases, protection against infections lessens, pH balance is disrupted, and the vaginal walls become thinner, more sensitive, and more vulnerable. The risk of infections, burning, pain, and even urinary incontinence significantly increases. What's most alarming? Almost no one discusses any of this seriously. Most women simply suffer in silence, and many don't even realize these symptoms have a name, a cause, and most importantly, a solution. A study published in the Journal of the American Geriatric Society observed over 2,000 women over 60, revealing that more than 70% reported uncomfortable symptoms in their intimate area, but only 15% sought help or received appropriate guidance. This means the problem exists, but the silence is even greater. And this silence gradually undermines the health of millions of women due to a lack of information, fear, shame, or the belief that this is just how it is. But no, it doesn't have to be this way, and that is precisely why this video exists. Today, in 4 very important parts, I will show you the essential care measures every woman over 60 should know for her intimate area. We'll discuss them naturally, respectfully, and clearly, without taboos or shame, because your health can no longer wait. So, please write in the comments your age and where you are watching from. This helps me understand how far this message has reached and who is with me on this mission to restore dignity, pleasure, and health to the mature women of our country. Let's begin. Part 1. The truth about the vaginal mucosa after 60. As women age, their bodies undergo many changes, but few are as ignored as those affecting the vaginal lining. After menopause, estrogen levels, the primary hormone protecting this area, drop sharply. What does this cause? The vaginal walls become thinner and more sensitive. Natural lubrication disappears or dramatically reduces, and the pH becomes more acidic, disrupting the balance of protective bacteria. Blood circulation in the area decreases, making tissues more fragile, and the risk of pain, infections, bleeding, and burning significantly increases. This condition is called post-menopausal vaginal atrophy. However, many women only realize something is wrong after years of silent suffering. Few know that natural ways exist to strengthen this mucosa. With regular care, you can restore vitality to your intimate zone without needing synthetic hormones or expensive procedures. Here are 3 simple actions that help protect the vaginal mucosa after 60. First, natural oils. Using pure vegetable oils, such as unrefined cold-pressed coconut oil, can help restore local lubrication and protect against microorganisms. Second, activate blood circulation. Gentle walks, pelvic contractions, and even light touches to the area promote blood flow, which nourishes tissues and accelerates recovery. Third, nutrition-rich in phytoestrogens. Flax seeds, fermented soy products, yams, and chickpeas contain natural compounds that help balance the effects of declining hormone levels. One study, published in the Brazilian Journal of Gynecology and Obstetrics, showed that women who regularly use coconut oil in their intimate area reported significant improvements in lubrication and reduced discomfort in less than 30 days, all without side effects. In other words, nature provides us with resources, but you must allow yourself to take care of yourself. Part 2. What happens to vaginal pH after 60, and how to restore balance before infections, discharge, and burning appear. Did you know your intimate area has a natural pH, a specific acidity level that protects against fungi, bacteria, and inflammation? When you were younger, this pH was slightly acidic, and your flora was rich in beneficial lactobacilli, which created a true protective wall against any foreign organisms. But with the onset of menopause and declining estrogen levels, everything changes. The pH balance is disrupted, lactobacilli disappear, the mucosa becomes more vulnerable, and natural protection breaks down. The result: unusual discharge, constant itching, burning sensations, and infections that appear, disappear, and reappear. What's worse is that these symptoms are often mistaken for poor hygiene, causing even more shame and silence. But now you know the truth. This isn't a lack of care, it's a lack of information. Fortunately, natural ways exist to help restore pH and rebuild this protective barrier. Look, fermented foods such as kefir, unsweetened natural yogurt, and sauerkraut help restore vaginal microflora from within, balancing pH and strengthening immunity in the area. Avoid regular soap. Most soaps have a neutral or alkaline pH, which further irritates the delicate mucosa. Opt for a mild, intimate wash with an acidic pH. Finally, sitz baths with apple cider vinegar. Add 1 tablespoon of organic apple cider vinegar to 1 liter of warm water and soak for 10 minutes twice a week. This helps restore pH and soothes mild irritations. A study published in the journal Menopause showed that women over 60 who began applying measures to restore vaginal pH saw a 63% reduction in the frequency of urinary tract infections and recurrent candidiasis episodes. This means that when you address the foundation, everything starts to improve. Part 3. The link between vaginal dryness, insomnia, and decreased libido, and what you can do to restore pleasure and well-being. Have you ever felt irritable, had disrupted sleep, and a complete lack of desire to do anything without understanding exactly why? Perhaps you didn't notice, but it might all start with your intimate zone. Vaginal dryness isn't just physical discomfort. It's a signal that something inside you is beginning to shut down. The lack of lubrication is directly linked to declining estrogen levels, the very hormone that regulates sleep, desire, mood, and even the production of serotonin, known as the happiness hormone. This means that when this part of your feminine essence goes dormant, everything else starts to dim along with it. You sleep poorly, wake up tired, feel disconnected from your own body, and over time, even pleasure becomes something distant or painful. But this is not the end of the journey. Science has already shown that natural ways exist to reactivate these functions without synthetic hormones or pills with side effects. Here's what can help. Omega-3 and vitamin E, found in seeds like flaxseed, sunflower, and sesame oil, naturally help moisturize internal tissues and balance hormonal levels. Adaptogenic plants, such as Peruvian maca and ashwagandha, strengthen the female hormonal system, boost energy levels, enhance desire, and improve sleep quality. Intimate care with natural oils, such as almond or rosehip oil, can be gently applied to the mucosa for hydration and comfort. One study, published in the journal Complementary Therapies in Medicine, showed that women who used Peruvian maca extract for 6 weeks reported improved lubrication, increased sexual desire, and deeper sleep. Most importantly, all of this occurred without side effects, without dependence, and with a new sense of connection to their own bodies, because pleasure has no expiration date. Intimate health is also part of your vitality, and caring for it is an act of self-respect. Part 4. Hygiene and shower mistakes that harm intimate health in older women, and how to avoid them with simple actions. It might seem strange, but many women harm their intimate area precisely during hygiene routines. Yes, it's true. Due to a lack of correct information, intimate hygiene is often performed too aggressively, and over time, this destroys the natural protection of the vagina. Here are the most common mistakes. First, using regular soap or antibacterial agents. These destroy beneficial bacteria and disrupt pH, making the mucosa even more vulnerable. Antibacterial soap dries out and irritates the delicate skin of the intimate area, especially after 60. Second, washing with force, loofahs, or scrubbing. The skin of the vulva is sensitive, thin, and becomes even more fragile with age. Strong rubbing or excessive cleaning can cause micro tears, redness, and even hidden inflammation. Third, internal douching or vaginal washes. This is one of the most harmful habits. The vagina has a natural self-cleaning mechanism. When you introduce water or liquids internally, you destroy this protection. Fourth, using wet wipes, talc, or scented intimate products. These contain alcohol, fragrances, and chemicals that irritate and disrupt the balance of microflora, even those that seem gentle. Now, let's look at what science recommends for women over 60. Use an intimate wash with a pH between 3.5 and 4.5, only for the external vulvar area. Wash gently by hand, without a loofah and without scrubbing. Pat dry with a soft towel, just touching the skin, don't rub. Avoid any scented products in the intimate area, even those specifically for women. Finally, wear cotton underwear and sleep without panties at least twice a week. This allows the skin to breathe and reduces moisture. A study published in the Harvard Women's Health Watch showed that older women who began implementing a gentler intimate care routine reported a significant reduction in infections, irritations, and recurrent discomfort. This means the gentler you are, the healthier you'll be. Caring for your intimate zone isn't overdoing it. It's respecting the most delicate part of your body. Part 5. Weakening of the pelvic floor and how to regain bladder control, intimate firmness, and pleasure with simple exercises. Have you ever experienced involuntary urine leakage when coughing, sneezing, or laughing? Or felt a strange pressure in your intimate area, as if something is dropping? This isn't a weakness of character. It's a weakening of your pelvic floor muscles. This system of muscles and ligaments is responsible for supporting the bladder, uterus, and intestines. It's also directly related to intimate pleasure, urinary control, and vaginal firmness. But after 60, this musculature loses strength, elasticity, and tone, especially if you've had natural childbirth, haven't been physically active for many years, suffer from constipation, or have never received recommendations to strengthen this area. The result: urinary incontinence, a feeling of weakness and laxity, and decreased intimate pleasure. In more severe cases, vaginal prolapse occurs, where the bladder or uterus descends through the vagina. What's most absurd is that most women live their entire lives without knowing that this area can be strengthened with simple exercises. They are called Kegel exercises. These are gentle, controlled contractions that activate the pelvic floor muscles and help control urination, increase intimate firmness, enhance pleasure, and avoid surgery in the future. Here's how to start right now. Empty your bladder. Sit or lie down in a comfortable position. Contract the muscles of your vagina and anus, as if you're trying to stop urination. Hold for 5 seconds, then relax for 5 seconds. Repeat 10 to 15 times, twice a day. Within just a few weeks, many women report improved urinary control and increased intimate pleasure. A study published in the International Urogynecology Journal showed that women over 60 who performed Kegel exercises for 12 weeks experienced a 74% reduction in mild to moderate urinary incontinence. It's simple, it's free, and it can transform your intimate health from the inside out. If you are ready to take control of your intimate health and no longer stay silent about problems that are not commonly discussed, subscribe to the channel. Here, we will continue to share natural solutions and expert advice on women's well-being, so you can live a full and happy life at any age. Caring for your intimate health isn't a whim. It's vitality, dignity, and self-love. After 60, the body changes, but that doesn't mean you have to put up with pain, dryness, discomfort, or shame as an inevitable part of aging. On the contrary, now more than ever, you deserve more comfort, more pleasure, and more respect for your body, starting with yourself. If this video has helped you in any way, please share it with other women. Perhaps this is exactly what your sister, friend, or even your mother needs. Those who never dared to ask these questions. Let's spread this information with openness and courage, because aging doesn't mean staying silent. It means powerfully embracing all that we can still be.